And what I'd like to do is start out by playing a video. Pretty amazing video, but it really exemplifies why we're here, which is to beat this disease, to knock out macular degeneration. So let me play this video.
Right before I began the program with you, and this is what was prompted me to begin it, was the center of my vision was disappearing. And when I would use the grid, there were irregular lines. And I knew that was testing my macular degeneration. But when my sight in the center of anything I was looking at was no longer clear, I knew I had to do something and do something fast.
And did the program improve your sight in the center?
Yes, it did. Definitely did. Before I began the macular program, when I looked at the grid, it definitely had lines that were irregular. And it had progressed as time was going on, and I was under care of a retina clinic. Once I started the program, I saw results probably within 6 months. Within 2 years, I now was seeing the center of my vision that had disappeared was totally intact and clear again. The grid, as I would look at my right eye and then look with my left eye, the lines were straight again. Major difference.
It's fantastic. That's beautiful. Well, that's why we developed the macular program, because of patients like you. So Margaret was a very interesting case, and I thought we would share Margaret's experience. She was being watched. She lost her central vision, or some of it, and then it actually was reversed. And that's really the whole key to this presentation today, is to talk about how that was possible. So let me pull up my slides, and we'll get into it. And I'll explain a great deal. Dr. Bakke will be right there with me as well. Dr. Bakke is a PhD in biochemistry, so we're very fortunate to have him as part of this presentation. So the goal is how to protect your vision, how to prevent, stabilize, or even reverse macular degeneration. Now, this presentation is for people with macular degeneration, whether it's dry or wet, and it's also for those who have geographic atrophy, something you would know if you had it because your doctor might have told you that you have it. And I'll explain all of this in a moment. It's also very valuable for people with diabetic retinopathy and pretty much many age-related diseases, which we're not going to get into in great detail today, but keep in the back of your mind that what we're talking about doing for the macula can also benefit much else. So this is for those with macular degeneration, dry or wet, or geographic atrophy, or diabetic retinopathy, and other age-related diseases. Now, this presentation is not for those who have a macular hole. You would know that if you had one, your doctor would have told you that. So we can't fix a macular hole. If there's a stroke to the retina from an artery occlusion, we don't have much value there. This is not for corneal diseases. It's not for floaters. And I have a general thought here, and that is that if you have severe vision loss where you can barely count fingers, and if that's been going on for 2 years or longer, it's probable that your macula is gone. It's like a dark spot here, and there's not much we can do if it's that bad. So that's sort of a general way to think about whether this presentation is right for you. So let's start out with what went wrong with the management of macular degeneration. I'm going to share with you a hidden truth about eye care and this disease. And the truth is the following. The current eye vitamins that you have been taking have failed to stop macular degeneration. And you probably know that because you're here in this presentation. But they failed to stop macular degeneration for good reasons. What is that? And the answer is here. 20 years ago, I was in a cab with a retina doctor who was involved in the studies for ARADS, the current vitamins people take. And he said something to me that was rather shocking. He said, we did the ARAD study to disprove the value of nutraceuticals. You got to think about that for a second. What do you mean disprove? That's a very strange statement. It wasn't to prove the value, it was to disprove the value. If the real goal had been to prove the value of nutraceuticals, imagine what could have been discovered. And this is where it all started. ARADS was sort of like a straw man. It was a weak study that really never had much of a chance to do anything. Because if you look at the ARADS formulation, it's pretty meek, right? It's pretty simplistic. Vitamin C, vitamin E, beta carotene, zinc, copper, lutein, zeaxanthine. I mean, that's it. That's all you've got for me to try to stop a degenerative disease of the macula. So the problem with ARADS from the beginning was that it was set up to fail or almost fail. It was a simplistic study, it's a simplistic formulation. It was one size fits all. It did not prevent dry disease. It does not prevent wet disease. It does not improve vision, but it did help a little bit though. It helped about 1 in 17 people. So why has this been so strongly promoted since 1992 when it can only help a small number of people? That's the real question. But the bottom line is that as a result of this very weak formulation, we have more and more and more people with macular degeneration. The numbers just keep on climbing. And the older people get, the more prevalent the disease becomes and more vision is lost. It's a real problem. And it's because they didn't do the job of determining what can we really do with nutraceuticals, with vitamins, supplements, hormones, nutrition, because they're very powerful. You probably already know that nutraceuticals can balance cholesterol, improve your mood, help your bones, support the heart, lower inflammation, stabilize blood sugar, reduce joint pain, normalize blood test results. So the macular question is, if nutraceuticals can do all of this, why not benefit the macula too? And the answer is the following. Eye doctors are just not aware of the science behind nutraceuticals. It's functional medicine. They don't know how to do this. There's a lack of training and time to implement this in their current model. And so for 20 years, we've been giving all of you a very simplistic therapeutic approach to treating a very complicated disease. The excuse always is we need more research. But after 20 years of inaction, here we are today with millions of people who are struggling to keep their sight. And that's a real problem. Had we done that, had the focus had been to prove and show or figure out how to really take care of the macula with hormones and nutraceuticals and vitamins, et cetera, instead of a straw dog simplistic formulation here, you'd have this, the Macula Program, where you're trying to do everything we can to prove the value and find the value of nutraceuticals to help the macula. And that's what we're going to prove to you today. So I think it's sad. You know, as an ophthalmologist in practice now for over 40 years, I've seen it all. And I have a real profound sadness that so many people have lost vision, quite frankly, because top doctors and scientists fail to do their utmost to treat macular degeneration using the best and most thought out strategies with vitamins, supplements, and nutraceuticals. It's really sad. It's terrible. So as a result, we have this situation here. We have a progressive disease. It starts out as shown here, where you can't even see it. I'll go through these quickly. And then it develops into a structural disease where you have spots in the back of the eye called drusen, and many of you in the audience are probably in this area here. Or it started to leak and bleed, in which case eye injections become necessary to treat the leakage and the bleeding in the back of the eye. That's called wet macular. So wet macular, dry macular, and then this stage here, which is the invisible stage, which I'll teach you about now. So let's go over the invisible stage. Probably very few people in the audience know they have this stage. Only very few eye doctors have a machine called the ADAPT-DX, which can determine if the disease is present, but you can't see it in the eye. You can only test for it. It's an interesting test. They shine a bright light into your eye, bam, and then they calculate the amount of time it takes to recover from the flash of bright light. So if it takes you more than 5 minutes, it means your macula, the cells in your macula, are not working properly. And that's because something's wrong with it. There's something wrong with the biochemistry of the cells, and they're not recovering from that bright flash of light. If you can treat the eye at this part or stage of the disease, you can pretty arguably cure the problem, because then You'll never develop structural disease. You'll never lose vision. But very few eye doctors have the machinery to do this type of analysis. And as a result, very few people are caught at this very, very early stage where there's biochemical dysfunction in the macula. Now, if it continues, which it does, then you develop dry macula like we described earlier. And here there are structural changes. There's structural damage. Something is altering in the macula, and we call them drusen, these spots here in the back of the eye. Many of you with dry macular degeneration have drusen. Many of you with wet macular had drusen and still have drusen. And they're caused by something, right? They've got to be caused by problems with the biochemistry in the macula, which I like to describe as deficiencies and toxicities. Some things that you're doing or have about you are toxic to your macula, or you have problems with your biochemistry where you have deficiencies. This can lead to oxidative damage, inflammation, and other related dysfunctions. So there's a lot that can go wrong with the cells in your macula that led to this structural change. And something else is happening in your macula as well, which is this substance here, which I'll teach you a lot about today, called VEGF. It's an interesting substance which leads to the next part of the disease, which is called wet macular. So this is probably where most of you are or were at some point. You had drusen in the back of your eye. Your doctor gave you the ARADS formulation, which is weak and doesn't do very much. Maybe you were told to eat green leafy vegetables, and then you were told, hey, call us if your vision worsens. Does that relate to what you may have been experiencing? Because that's the typical way this disease is approached. They look back here, they go, oh, you got macular, take the vitamins, you call me if your vision gets worse. And that's really bad advice, because you want to catch the disease as quick as you can before it progresses. That's what we're going to talk about today. Now, wet macular degeneration, for those of you who don't know, is a situation where blood vessels start to grow and invade into the macula. I use the word invasion of blood vessels, and that they happen to the macula. They invade because of this substance called VEGF again. VEGF is the substance that causes the blood vessels to invade the macula. It leads to leakage, it leads to bleeding, and again, it's caused by VEGF elevation. But it's also caused by oxidative damage and inflammation. So the same problems that got you here, where you develop structural damage to the macula, are the same problems that cause the VEGF levels to grow and rise, which then cause the inflammation to occur. And that's what leads to the need for eye injections. And a lot of people today are getting eye injections. If you're getting eye injections, you probably are going to a retina doctor where you walk into his office and then there might be 50 people there just waiting to get their eyes injected. And that saddens me a lot, because I think we can reduce that quite a bit. And then there's this other type of disease that some of you in the audience may have or will get in the future. It's called geographic atrophy. That's where areas, that's why you see the word geographic, where areas of the macula become destroyed. It's usually due to inflammation, and with more and more time, these areas get bigger and bigger. The current treatment for this right now is actually eye injections. And we're going to talk a lot about that, because if you have geographic atrophy, we don't think you need those eye injections. We'll talk more about that later on. So there you have it. We're here today to talk about a disease that affects the biochemistry of the macula, leading to structural damage, leading to VEGF elevation, leading to leakage and bleeding, or geographic atrophy. The net effect is you lose your central vision, which is a horrible situation, because you need your central vision to read, to see your grandkids, to drive a car, to just function in your daily life. And it's just really pitiful that you get older and this disease happens, and all the eye doctors have for you is simple vitamins that don't work. And that's really just a sad circumstance. Dr. Baki, I know you're listening in. Any commentary from you at this point, or should I keep going?
No, I think this is absolutely incredible, and that, you know, the science, how it's evolved in the last 20 years. And I think some of the critical points that you've made is the lack of implementation around solving some of these really serious and complex challenges. We have options and opportunities. There's just a lack of will and training and experience and to be able to do it. And I think, what you're showing is the end result of that, the devastating effects of the progression of this disease.
Thank you. Perfectly stated. So that's where we come in. The story is fascinating. I'm Dr. Rozakis. I'm an ophthalmologist, and we have Dr. Brian Bakke, who's a PhD in biochemistry. My background was engineering, or is engineering. I went to Cornell Medical School. I went to the Duke Eye Center where I studied ophthalmology. I'm actually one of the pioneers of PRK and LASIK. If you check me out in the patent office, you'll see a whole bunch of patents on laser eye surgery for reading glasses and things like that. But then I got introduced to this fascinating world of anti-aging medicine. And I loved it because it appealed to my engineering brain because it made sense. It's like, what can we do to fix the biochemistry of a cell so that the cell doesn't become sick? That's the essence of anti-aging medicine. But to do this well, I needed help because I didn't know a whole lot about biochemistry. I was an engineer, and they don't teach you much biochemistry in medical school. So luckily for all of us, we found Dr. Bakke, who's a PhD in biochemistry. He also has a master's degree in nutrition. And when he obtained his master's degree in nutrition, his master's thesis focused on macular degeneration. And we've been working now for over 12, 13 years, and we developed a method for cell health. That's how we started thinking about this. Because making cells healthier is the key to longevity and fighting disease. If you nurture your cells will nurture you back, giving you a longer, healthier life. And what's happening in macular degeneration? It's the cells in your macula are becoming sick and they're dying. And that's what we have to stop. So it was a nice fit, between what we were doing and the macular problem. So we developed a method. And our method is based on history, your medical history, and that gives us clues as to what's going on, and laboratory studies. Don't you find it really bizarre that you're sitting there with a disease that might blind you, and no one's even bothering to test any laboratory numbers to see if they can find something that might account for your problem with your vision? It's almost ridiculous. I mean, they do blood work for everything else, don't they? But when it comes to losing your vision, people just don't seem to care what we do. So we look at labs and we look at history. And what we're trying to do is make this cell healthy, because you see, there are many different reasons why that cell might be degenerating. Number one, it could be hormonal deficiencies. As you got older, your hormones changed in your body. They started to decline. Well, cells need hormones to be instructed as to how to thrive and be healthy. So hormonal decline is one of the possible causes of degeneration of cells. Another cause of degeneration of cells is oxidative damage, where the cell becomes attacked by these radical little oxygen molecules, or the cell loses its ability to fight against oxidation, because the cell has capabilities to defend itself. So if it loses those abilities to defend itself, then it can be more susceptible to oxidative damage. Another area that might cause degeneration of cells has to do with something called methylation. Methylation is a very interesting type of biochemistry which helps the cell turn on its good genes and turn off its bad genes. It does it all the time. All your life, you've been turning your good genes on or turning your bad genes off to just adapt to various situations. But what can happen is, as you get older, the genes that fight oxidation start to not turn on anymore. So now your cell is a sitting duck for oxidative damage. Or the genes that deal with inflammation start to become overactive. And that means that the cell is now at risk of damage from inflammation. Now, if the cell has the ability to fight inflammation, great. If it doesn't, that's not great. That's a problem. You're susceptible to cell damage. And this thing called methylation has a lot to do with helping the cells turn its good genes on and its bad genes off. And there are other genes as well that matter. There are genes that help your cell repair its DNA. If the DNA starts to not work properly, you have repair mechanisms that allow your cells to repair its DNA. But that's only if those genes are working properly. You see, you getting the point? See, there's a lot going on here. It's not just, simple vitamin E, vitamin C, and the ARADS formulation that you're taking. There's a lot to be thought through about what I can do to make this cell healthy as we get older. Nutrition, of course, matters a lot. Nutrition can also affect inflammation, and it can also affect oxidative stress. It can also affect methylation. Genetics matter because maybe in your family history, somebody in your family has macular degeneration. So you might have a few genes in your body that predispose you to macular degeneration. And so the goal here is to try to turn those genes off so that you have less of a probability of developing macular degeneration. So you see how this all plays together? H-O-M-I-N-G, homing is the word we use. This is what we developed. This is our method, a method that goes after all the possible reasons why this cell is degenerating. And the beauty of this method is that it improves the biochemistry of cells, and it treats deficiencies and toxicities that might be happening to cause damage to the cell. That is the core, that is the method that we developed over many years. So in summary, the method that Dr. Bakke and I created helps cells repair DNA damage. It helps cells produce energy. It helps reduce oxidative stress, reduce inflammation, turn on good genes, turn off bad genes. All of this will heal the biochemistry inside the cell to help the cell restore its proper optimal function. That's what this beast here is denoting. It's like we can do a lot more than those simple vitamins you're taking now, which are arguably pathetic. Now, here's a key that's interesting. It's fascinating. I want you to really get this. Now, Dr. Bakke and I did not start with the treatment of macular degeneration. We didn't start there. We were treating just people. My LASIK patients would come in with depression, anxiety. They're getting older. They're fatiguing. They're getting depressed. And just typical age-related aggravations. And we treated them, and we were making them feel good, look good. It's great. And we won an award for our work. It was the Advancements in Healthcare Award. It was given out to one doctor in Cleveland back in 2015, and we won the award for this method to help improve cellular function. And then what happened was we started to see a few people with macular degeneration do well on this program that we had created for general health. So we started to wonder to ourselves, what's going on here? Did we just serendipitously trip over something here? Because we didn't know that this could actually help the macula. So we did a study. We said, let's prove this to ourselves or not. Either we're going to find it or not find it. So we actually did a study looking at 365 eyes. We did this 5 years ago to see if it would help dry macular or wet macular. That's what we did. So we published the paper on this, on the data. And we called it the homing trial, which I, a moment ago, spelled out for you. Hormones, oxidation, methylation, inflammation, nutrition, and genetics. The homing trial. And what we found for dry macular degeneration is that about 48% of people showed an improvement in vision. They would see better. And they would tell us they're seeing better. It wasn't a mystery. They were seeing better. And the rest were basically stable, if not all of them. But the thing that was so shocking about this study, which is why we're here, is that 48% improved. That's big, because it's not supposed to get better. So in other words, if everybody was stable for about a year or so, what are you going to do with that data? Stability for about a year, can you really hang your hat on that? I don't know, maybe, maybe not. But if you've got 48% of people improving, it's like, whoa, that's a significant observation. So this really got our attention that we were onto something. And here we are 5 years later, and we continue to see long-term stability and or improvement. But it's not everybody that gets better, 48%. So there's meaning to that statement. And we're going to talk about that in a second. And here's the meaning of it. Because only 48% of people get better and the rest stay stable, we have to treat before irreversible vision loss occurs. You see, if your vision loss is reversible, then we can get something back. That's the 48%. But if it's not reversible because the damage is too extensive, then we can't get it back. All we can do is stabilize it. So it's very important to get treated before irreversibility starts to happen, where you can't get into that 48% group because you waited too long. And so I have a picture here of a house where the fire was allowed to progress to the point where the entire house burns down. That's the group that doesn't get better. But if they had caught the fire early, when it was a little fire in the basement, then you have an opportunity to save the vision and get some vision back. So I have this picture here of a retina to try to drive the point home, showing drusen in the background and all these little tiny fires here. This is what's going on in your macula. Your macula is on fire. You've got to put the fires out if you want to get into the group that's going to get vision back, or at least let's stabilize it. Dr. Bakke, I'd like any thoughts that you have as I'm speaking these messages?
Yeah, I think the mantra that we've shared with our patients over the years and between us is that prevention is treatment, right? I mean, that is the most effective way to treat something, is to stop it before it starts. And you don't ever want to have to roll the dice, so to speak. What the study demonstrated was that we do have the ability to treat under certain circumstances, as you mentioned, as long as there's no irreversible damage. But obviously, the more effective strategy for all conditions that are, age-related is to keep them from starting in the first place.
Exactly. And so again, how does this work? Well, we're helping the cell fix its DNA, lower oxidation, lower inflammation, also lower VEGF, which we'll talk about more, and increase energy production. There are things we can do with nutraceuticals to help the cells thrive. That's the key. So let's talk to some of the patients and look at some of the patients. Here's the first patient that led us down this path of discovery. It actually was my mother, of all people. And we put her on our program. This is before we had the macular program. We just did it so she would age more gracefully and more healthily. And we realized that her macular degeneration was not getting worse. It took me about 3-4 years to realize it. But once I did, I said, hey, this is kind of interesting. And fast forward, she went on for 15 full years to stay stable. And that's really a lot of years. That's impressive. So that was our first case. That was the landmark case. Then we had a patient who improved. This was back in 2013. And we actually did a press release, very excited. We said, hey, guys, let's get beyond ARADS. We can get vision improvement in macular degeneration using hormones, genetics, methylation, nutrition, and antioxidative therapy. And her story was fascinating. She said that she had lost vision. She could only read her Kindle if it was set to large type. And after she was put on the program, she was able to set her Kindle to small sized lettering again. So that got our attention that we could help. And these are the people that led to the study that we did. So here's a few interesting cases I want to mention. Here's a patient, her name is Marilyn. She says, as I previously reported, my left or good eye tested at 20/50. After less than a year, it was 20/40. It's a line of vision, that's great. Now it's 20/30. And I haven't had any illness, not even a cold, since January 2020. So she's somebody that we started the program on at 20/50, and she went down to 20/30. So she had reversibility. We treated her before her situation became irreversible. Peggy's an amazing case. She has very large drusen here, this very large abnormality you can see in the upper right. And after being on the program, it just melted away. And she was extremely excited. And so was her retina doctor as well, because that just doesn't happen. So she is really happy. We have a video of her for this time. We'll play it later. Now, William is an important case for everybody to really lock into. So William comes to us and he's 20/80. No, excuse me. I'm sorry. He comes to us and he's 2400, very poor vision. So we put him on the program, and luckily we got him back to 20/80, and he can see TV better. But the point about William that I want to make is that this is a success, but it's a bitter success. Because I wish we had caught William when he was 2040 or 2050. We could have stopped the vision loss then and not have allowed it to get down to 2400. This is part of the mantra, treat before irreversible damage occurs. So he went down to 2400. He can only come back to 2080. Yes, he's better. Yes, he's happy because of that. But to me, I wish we had caught him early. That's why we do these webinars, to get the word out on this. Okay, let's talk about the wet patients. What was interesting about the wet patients is that there was a 60% success rate. And that success was defined as needing fewer eye injections or having better vision. And this is, I want to really try to explain this to you because it's really interesting. So it turns out that everything I explained to you thus far can actually suppress the gene that makes VEGF. Remember VEGF? VEGF was that substance that caused wet disease. It's the substance that is removed from the eye by eye injections. But it turned out that our method can actually suppress the gene that makes the VEGF. So if we can turn off the spigot that's creating the VEGF substance, then we have an opportunity to make it easier to treat the eye with the eye injections. And that's why people were noting that they were needing fewer eye injections on the program. And that was fascinating to me. That was really interesting. That was a big day for me when I started to realize and connect the dots between the homing strategy, hormones, oxidation, methylation, inflammation, nutrition, and genetics, this homing strategy, and suppressing the VEGF gene. But there's something else, though. The injections that are given are only given to get the leaking blood vessels to try to go away. They don't do anything to help the cells in the macula be healthy. You see, so if you're getting eye injections, the only thing the eye injections are doing is trying to make the leakage go away, but they're not trying to make the cells in the macula healthy. That's where we come in. So we're trying to make the cells in the macula healthy while your eye doctor is injecting you with medications, and we're also trying to make those injections less necessary. Hope you can follow that. Let's go. So here's an artistic rendition of what's going on. So here are those blood vessels we alluded to earlier, and they're breaking through and they're invading the macula and causing leakage. So the injections are trying to make these blood vessels go away, and we're trying to help, but we're also trying to keep these cells healthy so that they can still help you with your sight. That's the key. So we help lower VEGF and support the cells. That's the value there. So here's an interesting patient. She had this ugly looking lesion here. The eye injections were not working. When we put her on the program, that lesion just went away. We were so amazed by that she actually made the nightly news in Cleveland many years ago. Here's some testimonials. Just wanted to let you know that I had very positive news from my retina doctor today. He literally said, well, this doesn't ever happen, but your vision and your scans are improved. Woohoo, so very happy. I'm always like tuned in to what eye doctors tell their patients. So when a doctor says to a patient, hey, this never happens, but your vision and your scans are improved, there's no code there. That's just raw excitement, and that's great. Here's another doctor who's commenting on the results. And Wayne says the wet macula is now gone. So he went from wet to dry. That's wonderful. We see that. Doesn't happen to everybody, but it can happen. But he says the wet macula is now gone from my left eye. And I have unexpected improvement in the dry macula in my right eye. That's beautiful. His right eye, which was dry, is better. And his wet macula is gone. My eye doctor says this is the only case where the eyesight has recovered in wet disease given the condition it was in. That's a very powerful testimonial. And this eye doctor probably didn't even know that the patient was on the program. So it's kind of amusing when I'm aware of that. Now, here's something very important for all of you with dry disease. It's really, really important. Here you are with dry macular degeneration. you have drusen. There are the spots, the structural damage. Here are the drusen here. But the blood vessels have not yet invaded. They have not invaded. So when we put people like that on the program is going to cause the VEGF to not accumulate as much. It's going to turn off the genes that make VEGF. That's this red arrow here. This red arrow is the VEGF vector or force that's trying to make these blood vessels invade the macula, which you do not want. So the beauty of being on our program while you're dry is that we can turn down the genes that make the VEGF while you are dry, which will help slow down or stop the conversion to wet macular. So if I had dry macular degeneration, I don't want to go wet. I don't want any doctor sticking a needle into my eye every month or every 2 months. It's just no thank you. So if I can do the program and reduce my VEGF accumulation, then the vector forcing these blood vessels to invade will be less. And I might be spared the aggravation of needing eye injections. Dr. Bakke, did I make that point clear enough?
Yeah, I think that's a critical point. And as you said, even if the discomfort of the eye injection isn't enough, long-term exposure to eye injections repeatedly over and over and over again is not neutral. We know that there is the potential for eventually scar tissue and other problems to occur, month after month, year after year, if you're receiving these injections.
Right. Perfect. Okay. Okay, this is a complex subject for those of you who have developed geographic atrophy. So recently, they came out with medications that promise to slow the progression of geographic atrophy. What does that mean? It means they're designed to slow down the enlargement of these areas of atrophy. Now, what's interesting to us, to Dr. Bakke and I, is that over all these years we've been doing this, we have not noticed anybody whose atrophy was progressing. So in our minds, we're thinking to ourselves, hey, wait a minute. I don't think we need those eye injections. Do we need those eye injections? Why would we want to have if this was my eye and I had geographic atrophy, what would I do? I'll tell you what I would do. I would get on the program, because I think the program may actually stop the progression of geographic atrophy. And I would have an eye doctor keep close tabs on me to be sure that the progression has been slowed down or stopped. And he can do that because this is not a fast-moving disease in no way, shape, or form. It's a very slow-moving disease. So if I'm seeing okay and I'm getting my eyes checked and my geographic atrophy is not enlarging, I don't need to get an eye injection. So what I would do if it were my eye is I would get on the program and have somebody watch me closely. And only if I progressed on the program would I entertain the possibility of an eye injection. Now, everybody's macula is different. So the advice that we would give you or any particular person can vary based upon your exact circumstance. But in general, I just don't like the idea of getting eye injections when I can use the macular program and the homing method to take down the inflammation going on back here and keep the cells that remain healthy. So I hope that, Dr. Bakke, did I make that point clear? Because that's really an important point. A lot of people always ask us that question.
Yes, absolutely. That was beautifully stated.
Great. Okay. So if you nurture your cells will nurture you back. This is a beautiful concept to achieve health, not even just for the eyes, but for the whole body. And the key, again, is to keep cells healthy by reversing hormonal decline, turning on good genes and reducing oxidation, using methylation to help turn on good genes and turn off bad genes that cause inflammation. Eat smart, and let's try to turn off the genes that cause problems that you were born with. That's the homing method. And again, treat before irreversible vision loss occurs. Now, people have a hard time with that because you might be saying to yourself, hey, I still see okay. I still see okay. Yeah, okay, great. That's great. Let's keep it that way. Let's not let it go away. You might live another 20 years. And if you do, things will happen in those 20 years if you're not careful. So you have a progressive condition. So don't let that progressive condition get to a point where it affects your quality of life. So try to understand that there is a somewhat of an urgency to get treated if you have structural damage. What is structural damage? It's those spots I told you about earlier. And if those spots are there, your macula is degenerating. Stop it from doing so, because otherwise you might lose vision or you might go wet. I hope that made that as clear as I possibly can.